Angela Giles here with another episode of the Savage Angel podcast. I am so excited today. I have a very entertaining, fun guest, Dr. Nikolov. I think I pronounced your name right?
You did great.
Awesome. I love it. Now, I am excited to have him here because I'm all about learning about aesthetics and the latest and greatest. And I get to ask lots of questions. We're going to have an incredible conversation. But, Doctor, would you mind sharing with the viewers a little bit more about you, your backstory, how you came into this revolutionary new way of doing really cool sculpting and things like that?
I'm a plastic surgeon, board certified plastic surgeon. I've been in Beverly Hills for 30 years now. Same location, same floor, which is good because I don't know any better, but it's turns out it's the building to be. When I came here and I started my practice, I found it attractive and I've had no reason to move.
There you
The
go.
good news is I have seen all the changes in Beverly Hills, and generally that's one of the places that leads the nation in some of the latest techniques, some of the innovations, how we do some of the newer procedures. And I've been part of that. So being in this location has benefited me a whole lot by being able to interact with other doctors who are also on the forefront, and we can share and exchange ideas.
I like this. So you've been a plastic surgeon in Beverly Hills. That must have some stories.
Well, I do, and some I can share, and most of them I can't,
Well, I think it'd be
or
fun for
should
you.
not.
Well, there you go, right? I think it'd be fun for you to share at least one of your stories while we talk here.
Well, what is an interesting one? Probably one of my favorite things, and just because it tends to describe or maybe go against my philosophy of what I believe plastic surgery should be. I remember two twins who looked nothing like each other came in, and I think it turned out to be eventually a TV show. And the TV show wanted me to transform them. So one of them wanted to look like Brad Pitt, and I believe the other one wanted to look like Ben Affleck. Well, I can't blame them. They pick well, they have high aspirations. The problem was they looked nothing like them. They weren't even in the ballpark. And the reason that struck a chord with me is here there was so enamored that it's like, okay, it's Brad Pitt. It's awesome. I want to be him. But when you look at what God has given you, and not to get religious, but
True. I'm
how
fine with
we
that.
look,
Yeah.
that is something that you have to cherish. And yes, I'm a plastic surgeon. I'm all about optimizing what you want to do and to look your best. But when you're trying to look like someone totally different that you don't even resemble in any way, even like one body part doesn't look like that celebrity, it's not possible. And all of a sudden, for me, that's an identity thing. You have to first embrace who you are before you start thinking of improving who you are, looking better. But think of just being the better you versus trying to transform into another human being. So they wanted to come and film, and I hate to admit it, but I tried to be polite and not insult people. But I had to step out of the room, and it's like there was a little bit of a laugh. I made sure nobody was aware of it. It's what are you thinking? In what world would you think that you would ever look like that other person? Surely the show was done at some point, and I saw the afters. And again, of course, it's the same, nothing was accomplished. There was never that possibility. But the reason I bring that up is it strikes a chord that it's more important for us to be who we want to be versus trying to be someone else, even if that person is to be admired for their appearance, intelligence, whatever else it may be.
I really agree with that. It's so interesting that you talk about that. I have a group of 26,000 women in a Facebook community, and I actually just went live this morning and talked about stepping into your own identity, right? More from a mindset shift, but how important that is. And I think when you step into your own identity, you step into your own greatness. But you can still look your very best. So that's why we need people like you, doctor.
But with appearance, it's very important to embrace who you are.
Yeah,
We all, as human beings, have our own individual beauty.
we do.
Some, granted, more than others, or depending on the fad that year. But all of us have a lot of beauty that can be shown off. It's a question of showcasing your best parts and minimizing maybe things that are detracting from the total picture. And maybe the nose is a little too big to the chin, maybe the brows are too low, and just putting it in better harmony. But embrace what beauty you have. That is better than anything else that you try to imitate.
I love talking to you. I love your philosophy. It's really good. So that tells me that you must have a lot of patience. People refer you, you've been in the same area for a long time because I think you actually care about people versus, let's just make you into something totally different than who you are. I love that. So let's talk about your cell sound. What does that exactly do? What is the technique? Let's dive into that.
Well, as you've noticed, I'm very passionate about how I do things.
Yes.
And a lot of it has to do with I want to give one a natural result. I want the patient to look like they've never had any help. They've never even met me. They just happen to look good. And the goal is to get there in the least invasive way possible. I've been involved with many different minimally invasive, non invasive devices over the years because I'm always searching for something that can cheat the system, if you want to think about it that way, that it can get me the result I'm trying to achieve without extensive surgery or extensive trauma downtime to the patient. So I came across this new technology and it's unfocused ultrasound. First, and I've used ultrasound for 26, 27 years, so it's new to me. However, when first described, and I always laugh and I keep repeating this, but it's true, the person that told me about the device, I just said, "Hey, I love you, but somebody I knew well, but you know, get out of here.
Get out of here.
This is too good to be true. I don't want to deal with this. This is silly. You can't tell me that this little magic wand of ultrasound will go and be able to do this and this and so sure enough, I started reading more about it. To his credit, he was persistent because he believed in the technology and came around and said, no, you really have to look at this. And the reason it sounds too good to be true, this is unfocused ultrasound. First, there's no pain involved during the treatment. There's no downtime. That all of a sudden, most patients think, okay, if it's not hurting, it's not doing anything. And sometimes doctors think that too. But it improves the blood flow of the tissue, which is great.
Yeah,
It improves lymphatic drainage,
that's even better.
so the congestion.
Yeah.
As a result, it also improves collagen formation and the cell divide at a more youthful rate. And whenever you want to, you can actually reduce the fatty layer without killing the cells. And just they shrink down because they release the fatty deposit. So just by me describing this, it's like, okay, better flow, healthier tissue, and you lose weight when you want to. You understand why I was very skeptical.
Yeah, I really do.
So sure enough, I tried it. And after seeing the results and on standardized photography, et cetera, and with measurements, and you see the real difference, now I've drunk the Kool-Aid. I am totally on board because yes, it does work.
Well, I've seen some of your images on Instagram and I was like, "Whoa, this is really great." I was very excited to talk to you today because, I'm in my 50s and I have so many friends that are the same age and it's just like, you just want to look a little better, right?
Of course, we all want to look a little
Yeah.
better.
Yeah.
The definition of, well, you look for it in depression, in a lot of, there are a lot of negative signs as you get older, is the minute you stop caring about how you look,
Mhm.
you've given up. It's
Yeah.
not a good thing. We all care about how we look, whether we admit it or not, and maybe in different ways. But you want to put your best foot forward. When you're seeing people, you want to look, you want your hair to be combed, cut, you want a face where not only does it not offend, you want it to look good, where it looks friendly and people like it. And it
Exactly.
makes us feel good. And also the reaction from others makes us feel good as well. As a
100.
friend of mine would say, when you look good, you feel good. And when you feel good, you look good.
I like
So I thought that was kind of catchy. So I'm borrowing it. I wish it were my saying, but I thought it was pretty representative.
So with this cell sound methodology, how do women is it like a lot of downtime or no? Because it sounds like it's not painful.
It's not painful. If you had the treatment done, you can put your makeup on or not. You can go out to a gala immediately afterwards
Oh, wow.
and look normal, look good, and actually better than when you came in. And
Wow.
it's something you can apply to the face because, again, more blood flow, better looking skin, better looking tissue. We can sculpt under the chin so that you have a little better contouring. We can always reduce the abdomen, and that seems to be a little bit problematic for some of us. So you can sculpt the abdomen, the flanks, the thighs, and reduce the fat. And in the face, you don't have to reduce the fat. So that's the beauty. You can have fat loss or not. You have those options, but still improve the health of the tissue.
So if someone were to come and get it done on their face, is it just a one-time treatment or do you recommend like multiple?
Usually it's a series of 6 treatments,
Okay. How far
but
apart?
you will see a difference after a single treatment.
Wow.
I tell patients, I'm not here to sell you on this. Do one treatment, you don't like it, there is no package.
Right.
You can quit. You're gonna tell me. I haven't had one patient quit and decide that they don't want any more treatments. And for me, that kind of speaks volumes because if they didn't like it, they can be very subtle. There is no pressure. They just don't make another appointment. And they do. I don't even have to ask them. They go straight to the front and the receptionist. It's like, okay, when should I come in next? But because there is no trauma to the tissue, there is no inflammation. And those are important points. We know inflammation is not that great. You can do treatments. And yes, we recommend 6. It's usually 2 a week for 3 weeks. And you can vary the protocol in certain ways. And if you skip the treatment, it's not the end of the world. It's not like all of a sudden you have to start from scratch. But the important thing is if you're seeing great improvement and let's say you want to slim down a little bit more or you want to address another area, unlike other devices that it causes inflammation, basically it's a controlled burn. With this, the tissue is healthier. So you're not limited by how many treatments you can do. You're not causing any damage. Quite the opposite. And the proof of this and what got me interested initially is when I looked, and this started as a wound healing device. Wounds that wouldn't heal, they weren't getting enough blood. And this is how this started in treating wounds that wouldn't heal. And after a few treatments, you see progress, and soon you've made more progress than you have in a year just in a week or two. That tells me, yes, something good is happening. And the clinical part is much more important to me than the pathologic microscopic studies that may be done. If it works, you can't argue with results. So if it's going to heal a stalled wound, of course it's doing something good to your face or app. And one big thing that I haven't mentioned, it penetrates 10 centimeters in the abdomen. So, it's getting a little bit of that stubborn fat, especially for men, that it goes a little deeper and it's intra-abdominal fat. So it penetrates that deep that it affects that as well.
That's amazing. And what about like for me, for example, I had 3 C-sections and I've got that scar, right? Does it help with cuz it can be like almost like scar tissue in a little bit.
It helps scar tissue. I don't want to say that is the main application for it, but I have treat because I have it. And for me at this point, it's a toy. It's a toy where anything that improves blood flow, it's got to be good. So I have treated many scars and it helps. How bad the scar is, I don't know, but it would help. And but part of the issue with a C-section like that is not just the scar itself, but what happens is the scar is attached to the muscle underneath. So it's almost like a fixation point and it's drawn in a little bit. The scar doesn't look good, but then the tissue above it frequently kind of folds over just a little bit. And I'm not saying hanging, but it's just a little bit of a bulge over because the scar is attached to the deeper tissue and it's not a situation where you have healthy fat underneath to separate the skin from the deeper layers.
Got it. Well, it's very exciting. So I know that we will, when we share this episode out on Spotify and Apple, we'll definitely have all your contact information below. But I would love for you to share your website at least for the viewers, because I know with my big list and my big social media, women find out about this, they're going to love it. They're going to want to get a hold of you and book their appointments.
Well, I'm happy to share it. It's very easy. It's drnikolov.com. So
Okay.
that is DR.
Okay, perfect. Thank you. I love this. So is there anything else that you also do in your office that you feel like is groundbreaking or that you've perfected that you would love to share with the audience? Any last bits of advice?
It's interesting you would ask that because everybody claims they have the new groundbreaking
Yeah.
procedure or device. And very frequently, this is just another device that it was repackaged, or if it's a technique, something that people have used for many years, and it's just a variation of it. So taking credit for saying I do this and nobody else does, for me, it seems silly.
Yeah.
And we all like renaming procedures and saying it, okay, they tried. My first name is Nicholas, Nick. So they wanted me to do the Nick tuck. It's like, I'm sorry, I can't do that. And yes, I do certain variations of the procedures when it comes to facelifts. But the bottom line is very simple approach on my end. It's not the specific technique that's better. I think it's what's more important is to figure out specifically what the patient needs and not use the latest technique, but use the most appropriate technique for that patient and that patient's needs.
I'd love
And we
your
frequently get caught up in trends versus thinking what exactly is needed. And every patient needs a different kind of procedure. I do 6 different types of facelifts. No, deep plane facelift, everybody hears about it. It's been around for over 30 years, even much longer. Is it a bad procedure? No. Is it the best thing since sliced bread? No. Depends if that's what you need or not.
right. I totally
And
saying.
you need to be able to address specific needs and as a surgeon have the tools, not just be able to be enamored with one specific procedure, but be able to do more than one thing and vary it based on what a patient needs.
I
So
love that.
that's a really long-winded answer,
It's
but
a
it's
great
something I'm very passionate about because trends end up causing people not looking their best. It works for one, it doesn't work for everyone.
That's really true, and I love your whole philosophy about, stepping into your own it's almost like your own skin and embracing who you are and looking the very best with what God gave you. I think I love that because I've talked to other, you know, surgeons, I've interviewed a lot of different people, and this is the first time that I've actually heard someone say that, and I like the fact that it's all about finding the best solution for the patient. I think it's not like a factory, right? So it's interesting. I follow a lot of people on social media and I follow this doctor. I don't remember his name from China and he has people fly all over the world. And he just, I mean, it's like an assembly machine. And I'm like, I don't know that I would want to do something like that because it just feels like I said, an assembly machine. It doesn't feel like they actually look at you and say, well, here's this. How do you feel about this? It's just like this, like you're a number and I'm
This
not
is
a
the
number.
work.
Yeah.
Well, you look a little funny looking Chinese, so
You're funny. Awesome. Well, I really appreciate you coming on tonight. This has been really my pleasure. I've been looking forward to it for a couple weeks to have you on. You're funny too. You're a lot of fun. So this is great. So thank you so much. Is there any last thing that you want to share? Words of wisdom, anything before we sign off today?
all I can say is more isn't always better.
Huh?
It's important to do what rings true to you. Listen to your plastic surgeon or physician, but ultimately trust your instinct because you know yourself and you know where you want to be and what you want. And that's the most important part.
Amen to that. Well, thank you so much. I really appreciate it. And for those of you who are listening, make sure if this rings true to you and you want to talk to Dr. Nikolov, if I even now I pronounced that wrong,
Nikolov, you got it.
Nikolov. Okay, I got it. Please reach out to him. He's amazing. Thank you so much.
Well, thank you for having me. This has been a lot of fun.
Thank you.